Hello, this is Dr. Samin Afzal Junejo from Hyderabad, Singh, Pakistan. I'll show you a video on phaco emulsification on rocky hard cataract of grade 4 with minimum phaco energy. In this case, I have set the phaco energy at 50 and the nucleus is semi-dilated because there are a lot of liberations of prostaglandins E2 from the iris stroma during the process of phacoemulsification. And my technique is that I always use a phaco energy at extreme low phaco power, and then I apply a small gush of phaco at different sites on a hard cataract, at equator, in the center, at the mid periphery and periphery of the nucleus. I apply small phaco energy, gush of phaco, and I do not continue giving the phaco energy at a high rate, and I try to break the nucleus by applying small gush of phaco energy at different sites on the surface of the hard nucleus. Ultimately, within a couple of minutes, the whole nucleus is broken and it is taken up one by one by the phaco handpiece. And in this case, my phaco energy is set at 50 percent, and the vacuum is 550, and comfortably the hard nucleus has been emulsified. So my lesson is that whenever we come across a hard cataract, we should not increase the phaco energy and we should not give a continuous phaco power to remove the hard nucleus under high phaco energy, because it can cause damage inside the eye. It can also lead to the endothelial dysfunction. Ultimately, the patient can develop the bullous keratopathy and the permanent corneal opacity in future. So it's not necessary that the hard cataract is always dealt with the increased phaco energy. The nucleus is completely removed in presence of the viscoelastic solution. Irrigation and aspiration with Simcoe cannula is being carried out using the side ports. And the cortical matter is being cleaned out. Whenever we come across a small pupil or the pupil which is constricted during the process of phacoemulsification, we should always keep the phaco tip in the middle of the nucleus, this pupil, and we should not extend at the mid periphery or the periphery of the pupil. Viscoelastic solution is injected, anterior chamber is deepened, and the bag is filled with the OVD, and the foldable hydrophilic IQ lens is being implanted exactly in the bag. I always keep the haptics of the lens, a newly implanted lens, in a vertical position, because the lens is better fixed when the haptics are placed vertically facing towards 6 o'clock and 12 o'clock position rather than keeping the haptics horizontally at 3 o'clock and 9 o'clock. Now the viscoelastic solution is being washed out in order to avoid the refractive surprise, postoperative cellular reaction or transient rise of intraocular pressure. Removal of viscoelastic solution at the end of procedure is imminent. My lesson in this video is that whenever we come across a hard cataract, we should not necessarily increase the phaco energy. Under a minimum or low phaco energy, we can complete the procedure by giving a small gush of phaco, small bites at different spots on the hard nucleus, in the center, in the mid periphery, at the equator, and ultimately within a couple of minutes the hard nucleus will be weakened, broken down and taken up one by one by the phaco handpiece under a high vacuum, and we can avoid many complications which are bound to occur when the phaco energy is increased in hard cataracts. Thank you very much.